Many shades of pink and black health. Many shades of pink and black health, where good health equals long life. Welcome to the Many Shades of Pink and Black Health radio program on KBOKradio.com, sponsored by Many Shades of Pink. I'm your host, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo.
Today, our topic is Breast Cancer Awareness Month. As you guys know, October is, the month for breast cancer, and we've just been busy. I know about you, Doc. I've been so busy.
Yeah, we've had a lot of events, and we still have a few more to go before the end of the month. I
know, and as I said, I am a survivor, so I'm embarking on my 4th year of surviving the ugly monster, and so I am very, very happy. And for those of you that don't realize or know what both myself, well, actually Sis and I do out here in the community, part of it is empowering the community to educate them and take their breast health, make it more priority, mm-hmm. and for them to get their annual mammograms annually. So, Sis, you want to take it?
Yeah. So I think the most important thing is making all women aware, but especially African American women, aware of the importance of getting not only doing a self-breast exam, but also getting a clinical exam and then getting their annual mammogram. And the reason why is that in San Diego, I believe it's 6 out of every women will be diagnosed with breast cancer, and 1 woman every day will die from breast cancer in San Diego. The overall national numbers are 1 in 8, I believe.
Yeah, 1 in 8.
Yeah. So it's very significant for African American women. The problem is unfortunately, if they don't come in early enough, which is the problem, we end up finding them and diagnosing them at a later stage, stage 3, stage 4. We do know that they tend to have a more aggressive type of cancer. The cancer tends to come at an earlier age rather than a later stage. A later age, and by the time we find out about it or diagnose them, it's hard for us to really get the good survival rate. And so that's the importance of making sure that they start their screening at age 40 and do it every single year.
Well, also we know that African American women also have the lowest rate and percentage far as early detection. Mm-hmm. The number is very, very low. So with that being said, that means that, again, they're not coming in doing their annual mammograms, and we can't stress, how important this is, because our women are dying and they don't have to.
Yeah. And it's the death part certainly can be preventable.
Right.
We obviously don't know what the cause of breast cancer is at this point. That's why there's still so much research, and that's why we're still, doing all the fundraising, the Race for the Cure, which we'll get into later,
right,
to raise funds to continue the research so that we can find out really what is the cause of it and try to then prevent it. So since we can't prevent it at this stage, what we have to do is detect it early,
right,
and then give the women a very good fighting chance to have a long survival after they've been diagnosed with breast cancer.
Right. So this is what I always say to everyone. We know that most regular type of breast cancer, if it's caught early, then it's 99% curable. Mm-hmm. Yeah. Is that correct?
Yeah, I would say, probably close to 90%. That's good, mm-hmm. If caught early. I do know that African American women, the rates of us getting cancer are lower. Meaning, white Caucasian women are diagnosed with more breast cancer. So our rates are lower in terms of diagnosis, but our rates are higher in terms of death or mortality. So we are 41% higher in a mortality rate than the Caucasian women. But the overall numbers, we're much smaller in terms of numbers of total number of African American women that actually are diagnosed. And that's the scary part about it. Smaller population being diagnosed, but a higher percentage of us are dying from it.
So, how do you think that, we're in 2017, and we probably started our journey in 2015. What would you say, how have we been effective in the black community as far as educating our African American women, just giving them what they need. Not only that, but being here in the community, providing free mammograms.
Well, I think we've made an impact. If nothing more,
Right.
they've seen our names and our faces around, so they know that we're connected with Coleman's Circle of Promise, trying to promote, the educational piece, and definitely bringing out the mammogram, the mobile van, to various places, churches, and events and health fairs and street fairs and all those types of things. I think they now, our names and our faces are synonymous with that. So the word is out. They are also trying to reach out to both of us in terms of where can I get this and that, related to their breast health. But I think we still need to get the numbers out to actually get the mammograms done. So we have made an impact because, you've seen them on our monthly events where you're seeing, anywhere from 15 to 25 or 30 at any given time, but that's still not enough.
No, it's not. And, me doing our data, and what I was concerned about was reaching our African American women. While we out here in the community providing these free mammograms, I was not for sure if we were having an impact. And after doing the data, my heart smiled because I'm like, wow, it is, we're making a difference. And I was just like, oh my gosh, I was really overwhelmed where I teared up because I really felt like I was not reaching them. That they was not coming here, going to our different events, getting the mammograms. And I was just like, how you get to the point where,
Discouraged.
I was getting discouraged.
Yeah.
And I was like, are we doing what we need to do, or what could we do better? Just analyzing a lot of different things. But once I did complete the data demographics, we were higher. Our numbers, all the events that we've done, African Americans showed up more than the Latina, Hispanics, and Caucasians.
Okay. So obviously we are making a difference. It just doesn't feel like it at each one of the single events, but when you look at the data cumulatively, it look and compare it to the outreach for the Latino and the Caucasian populations, because they're doing their own outreach. We're strictly Circle of Promise, which is specific for the African American women. So when you start comparing our data to the other populations, I'm glad to hear that the women are coming out, that we are at least educating them at our events, and that several of them are getting their mammograms.
Yeah, and the thing of it is that, we advocate for all women, but especially African American women, because of that mortality rate being 41% higher than any other race. So I still say that we can do better because we want those numbers to go down.
Right. And every day I hear someone saying that, a friend of theirs or a relative of theirs was just diagnosed with breast cancer.
Right.
So those stories are still coming up. And I can still remember in my practice several young African American women that were diagnosed at an early age, in their early 40s, was in remission for a couple of years, had recurrence about 4 years later, and then died subsequently at like 45 years of age because of the breast cancer and it being aggressive. So, screening is definitely important, but we tend to get it at an earlier age. And I can remember when I was working at Kaiser that the first screening recommendation was age 50. Well, actually, a long time ago was age 35. So and then they changed it to 50.
So when did they, from 35 to 50, when did they change that?
It's been at least 15 years. It's been a long time. And
so they were doing it at 35 at one time.
Yeah, and I think it was for a short period of time, but it went to 50 because they do, obviously one of the risk factors is is age. As you get older, you're at higher risk for getting breast cancer. So they decided, and they, who knows who they are, but it's the medical profession and the probably, you know, OBGYN types of probably the boards and things like that that make a decision as to the weighing the risks and the benefits involved with having mammography, you know, the radiation exposure and things like that, that they, instead of exposing women at age 35 and doing that every year, I think the recommendation was a screening one at 35 and then again at 40, so it wasn't every year during that time. And then 40, probably another one somewhere in there, and then the annual one was 50 and above. But now they've changed it where it's starting at 40 and doing it annually.
Well, I feel like they need to go back to screening women at 35 because, as you know, African American women are diagnosed at an earlier stage and an earlier age, I must say. We're out in here in the community, and I mean, I'm running across 29-year-olds, 30, 35-year-olds, and you know, and they're telling me that they're having a hard time getting a mammogram. You know, they're telling me, well, oh, you're too young to have a mammogram, you know, and I'm like, okay, I understand what you're saying, and that's when I tell them that you demand a mammogram because they have to actually take their own health and basically make it a priority, and also be an advocate for their own health, because can't no one tell you about your own body but you.
Right.
So, with...
Right. No, that's true. And I think at some point they may have to make, I would hope, that they would make some recommendations for the African American women, that population, because we tend to have a more aggressive cancer. We tend to be diagnosed at an earlier age, that I would think they almost have to make a recommendation to consider starting screening at 35 for African American women, and maybe every 2 years you're in that point, and then when you get to 40, every year. I mean, they do that for men's health. For prostate cancer, they recommend for African American women to get, men to get a prostate exam at age 40 and a PSA at 40, because they're at much higher risk for prostate cancer in that population. And then all the other men start getting screening at 50.
So, okay, so our African American men can get a PSA, they can start getting PSA levels at age 40, and then they get the, so it just starts
and that's 40 and every year. But the difference about that is there really isn't a whole lot of risk. There is some risk, but it's a simple blood test.
It's a blood test.
The problem is they don't want to get a lot of false positives, because then you go through a whole biopsy process and things like that. But it's much less of a risk to have a blood test done than to have radiation exposure, you know, too much at an early age. So I do feel that it's at least a screening one at 35.
Okay.
And maybe 37, and then start again at 40 annually. That would be my recommendation if anyone asked me.
Well, we asking you, sis.
I don't get to make the rules, but that would be my rule, is to start African American women at age 35.
So you think that 35? You don't think 30?
No, I think the risks might outweigh the benefits. Now, I think 30 is a reasonable age if you have a strong family history, but then I would go with the genetic component and get testing, look through the genetic piece to see if you are at high risk. I'd rather you get a blood test, see if you have the markers for it, the BRCA genes, and if you do, then by all means you start getting tested earlier.
Right.
But I think 30 is a little too young to just start routinely.
Okay.
Yeah.
Well, we need to take a quick break. So you have been listening to the Many Shades of Pink and Black Health Radio program on KBOKradio.com.
And we'll be right back.
I'm a breast cancer survivor.
We are honoring our heroes.
I'm here today because of Susan G. Coleman's free mammogram.
We are pledging to save lives.
We're passionate about bringing the services out to the community.
We are providing free mammograms. We are providing hope.
We are more than pink.
Made possible by Anderson Plumbing, Heating and Air.
Welcome back to the Many Shades of Pink and Black Health Radio program on kblkradio.com, sponsored by Many Shades of Pink.
I'm your host, Wendy Shurelds, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo. And our subject today is Breast Cancer Awareness Month. And so before the break, we were talking about, just in general.
Yeah, we were talking about, the data and the percentages and things of that for the African American women. And I just, as you know, sis, this is just a very, very touchy subject for me. It's my passion. For those of you that do not know, while I was battling breast cancer, I battled with a very good friend of mine, Tanya Williams, and she actually passed. So this journey is just not for me, it's for her.
Mm-hmm.
I started, she's the reason why I do what I do. She was the one that was sharing her journey throughout the churches in San Diego. I battled my breast cancer more on a private level.
Mm-hmm.
I was more private, and she was more vocal with hers. And our journey to have, two sisters battling at the same time, same left breast, same type of cancer. Hers progressed, mine didn't. And as you know, I kind of live with that guilt.
Yeah.
Of her passing and I'm living.
Right. But that torch was passed on to you so that you could continue to just spread the word, the importance of why our women need to be examined, why they need to have their annual mammograms, the importance of it, and why we need to continue supporting all our women, because it's a tough battle.
It is. It definitely is. But at the time, I did not understand my journey.
Mm-hmm.
I did not understand, when God put, have a calling on your life.
Mm-hmm.
I totally understand it. I accept my assignment gladly. At the time, I didn't. I understand why he took her and why I'm still here.
Mm-hmm.
He left me here purposely because this is what my platform's supposed to be and what I'm supposed to do.
Right, right. Reach the women. Touch your other sisters who are recently diagnosed and don't know what to do. They feel lost, they feel overwhelmed, they feel alienated, and just to know and be able to speak to someone that's been through it before is helpful. It's supportive in terms of just letting them know that you can hold their hand and walk through that tough journey with them.
Oh yeah, it's been a journey for me.
Yeah.
It's been a journey, and that's why it's so, close to my heart. But not only that, but people need to know stress will kill you.
Yes. Yes.
And that's one of the other things that I like to touch on when I share my story. I share my story because I lost my mother in a preventable workplace incident. But because I went to that dark side, depression, stress, it will kill you. And that's why I feel like I developed breast cancer, and that's why people have to know that stress will kill you, and whatever you're enduring in life,
Right.
we cannot get outside of ourselves to where, we so busy, caught up doing what we need to do for other people. We have to take time out for ourselves.
Right. We need to make sure that we're a priority.
We're okay, because if we can't take care of ourselves and we're gone, how are we going to take care of others?
Right.
So that was something that I had to learn the hard way. But just losing your mother, someone, that you're, your whole life, that is your everything, and going to that dark side, and coming out of it to where I'm not a bitter person, to where all I want to do is help others.
Right.
Not when I had to battle and fight for my life, I felt like I was just sharing the same passion that I took when I was an advocate for workplace safety and fatality. Mm-hmm. And, the journey of it all, it just goes to show you how God basically, He placed you where He wants you to be, not where, you want to be. Mm-hmm. Never ever thought that I would be here having this type of platform, mm-hmm. being an advocate for breast cancer.
Right.
I just never thought that I would be in this type of position. But, God is good.
Right, right. And you're right. As you mentioned earlier, you're on a journey, but your mission and your purpose on this earth is very clear.
Right.
And it's very clear to you now.
It
At
is.
the time you did not know that you were being called on.
I didn't.
To step into this.
I kind of ran from it,
right.
because I did not understand it. And the difference is when you have the calling, things just take place.
Right.
It just happens.
Yeah.
I never looked for anything. It came to me.
Right.
Everything comes to me.
Right.
And that's when you know that God is placing you where He wants you to be.
Right.
And so it's like I'm on a mission, I'm on a journey to help save other women, and especially the women in the African American community, because my dear sister Tanya, she left 2 young boys. Mm-hmm. And, she died at 42.
Right.
And that right there within itself was heartbreaking, to know that those 2 little boys was not going to have their mother, but also to, it just, I don't take my, me being in remission, I don't take it for granted.
Oh, no.
I don't take it. It made me realize, never to take it for granted, because we thought that she was going to be okay. Mm-hmm. She was in remission, thought that she was going to be okay, and then it just came and it spread it, and it just took her.
Right.
And that's why I fight so hard for our African American women, to, this will kill you. Mm-hmm. Breast cancer will kill you if you do not take your breast health serious.
Right.
And, we as African American women, we tend to put everything else before our breast health care. You know that, mm-hmm. working as a doctor. Mm-hmm. What can we do when they put, I know we all have, a lot of us have high blood pressure, hypertension, diabetes,
weight issues, cholesterol,
right, and then weight, our weight issues can contribute to our breast cancer,
yes, it can.
Issues as well. Yeah. So it all kind of tie in.
Yeah, I think just having overall good health,
yeah.
is what's going to help prevent most of the medical conditions and some of the cancers and things like that. And that is just taking the time, number one, to focus on what is really the right thing to do. That is eating healthy and trying to eat as clean as you can, trying to avoid as much of the processed foods, mm-hmm. because I'm sure a lot of that stuff has some carcinogenic components to it.
Yes.
And that gets into your normal cells, change the cells, mm-hmm. and then they become mutant and cancerous, and next thing you know, you're growing some kind of a cancer. Making sure that your body is, what you're putting in is going to be healthy for it, so that you can combat some of the things that are out there, some of the viruses and the bacteria and things like that. But stress is a big one, making sure you get the amount of rest that you need so your body can regenerate. It's like recharging your batteries.
Yeah.
So you need to take the time out. And I do know just women in general, and especially African American women, we tend to have so much on our plate.
We do. We take care of everybody.
Everybody,
yes.
The neighbors, the friends,
yes.
the kids, the husband, the boyfriend, everything
yes.
else. And then you're last on the list. You have nothing to give yourself. Mm-hmm. And the next thing you know, you come down sick. The problem is when you're down, it seems like everything kind of folds.
Right.
Because we tend to be, in most families, the glue for the family.
Yes.
And so it's important that we take our health seriously, number one, put us first so that then we can continue to be healthy for our families and keep our families healthy, you know.
And I think that we have to apply that to ourselves because we are some very, very too busy women. And
we are.
We really are. And, you know, we have to start caring for ourselves as well, because our schedules are just kind of crazy, and we have to start I know you're going to take some time out in November, going on your vacation. I need to take me some time out anywhere, but
we're supposed to go on vacation in January, remember?
Yeah, but I'll wait until after you come back.
No, you and I are supposed to be going on vacation in January. We'll talk about that.
Okay.
Offline. They don't need to know where we're going, but we're gonna take a vacation. If we have gone through we would have gone through 2017 successfully. We need to reward ourselves because the next year is going to start off with a bang again. So early January, we're going to take a vacation. But anyway, so let's talk a little bit about, you know, because that, you know, obviously is very emotional for you because you've lived through the journey and you continue to walk through the journey with several people, which reminds you of the journey that you just took a few years ago.
Of course.
But there's so many risk factors, and we should probably at least list some so the women are aware of the risk factors. We do know that as you get older, you're at a higher risk.
Yes.
Even though that's why they screen at 50. So, you know, we're finding people at 60 and so with breast cancer, but our population has it at an early age. So we do need to make sure we're paying attention in our 30s and 40s.
Right.
Obviously, having a personal history or a family history of breast cancer is important. I mean, it does increase your risk, but we are finding that breast cancer in some of our people have no family history. So you can't just rely on that, and we'll go over the myths. You know, people think, oh, if I don't have a history of breast cancer in my family, I'm not at risk. That's not true.
Because I'm the first in my family.
And we're finding a lot of women, they're the first in their family.
Yeah.
So that seems to be, you know, one of the things that's coming up. But having a family history puts you at higher risk.
Yeah.
So it's important to know your family history on both the father and the mother side.
Yeah, because see that's where another thing that they, you know, we'll get into that because they think that they need to just know their mother's risk. And we know that a lot of our African American women in the community, a lot of them just don't know their father's history at all because a lot of them don't know their fathers, or they grew up without their fathers, and so a lot of them could be at risk from the father's side, but they don't know.
Right. That is very true. That's very true. Also, if women have had like a biopsy on their breast, say they had a lump in their breast and it had some kind of abnormal cells, it wasn't cancer at the time, but what they call hyperplasia or some kind of abnormal cells, they're certainly at higher risk for developing breast cancer later too.
So are you saying that those little nodules, are those like little cysts?
Well, there are several different types of changes in your breast. So you can have cysts, which are really just fluid-filled sacs. They're almost like a little tiny balloon with water in them or fluid in them. Those are not cancerous or precancerous, and those cysts can come and go. They actually go down on their own, they come up on their own. If they get large and they're tender, we just place a needle in them and draw the fluid out. And that takes away the pain and the pressure off of that, you know, from that cyst. But there's something called, the firmer ones are called fibroadenomas. It's a mixture of fibrous tissue and adipose tissue, and so adenomous tissue, which is rubbery. And those are not precancerous.
Okay,
but there is some cells called hyperplasia. Those are cells that are slightly changed, that are different, not fibroadenoma. That's like a, you know, like if you put a bunch of rubber bands together.
Right.
It's a rubbery kind of firm.
Right.
Right. So they can see those on an ultrasound. They can tell if you have a lump in your breast, and especially if you're younger, they're going to offer an ultrasound, which is the right thing to do. And then they can look at that ultrasound and see whether that lump in your breast is full of fluid, if it's a cyst, or if it's solid.
Okay.
And if it's solid, then it needs to be biopsied.
So, because you meet a lot of people that say, you know, that they have a lot of
lumpy, bumpy breasts.
Well, you know, they have a lot of they would say dense breasts.
And dense breasts, basically another term will be fibrocystic breasts.
Right.
So you'll have small fibrous and small cystic lesions, and that's fairly common.
Okay, so when they have the dense breast, what do you suggest that they get? Do they get the mammogram? They get the mammogram and the ultrasound if they are age 40 and above.
Most likely, because what will happen is a mammogram will just tell you whether or not there's any calcifications or these little speculations. They'll show up highlighting things that come up on the mammogram. The ultrasound is important because if you have dense breasts, there's also some fibrocystic changes, and you need to determine whether or not there's anything in there that looks suspicious. So yes, most likely your provider will offer both.
Okay, so I have a question. So what's the difference between getting a 3D mammogram versus getting a mammogram and an ultrasound? So can that 3D mammogram see what a ultrasound can they capture what an ultrasound can capture?
Now you're asking a tough question for someone that doesn't do radiology, but I'm gonna do my best. Remember, I'm family medicine, okay? That's okay. I'm gonna do my best. So the way how I know it is the 3D obviously gives you a more in-depth view of the breast tissue. So it is going to give you more highlights on the breast tissue than a 2D, which is what's offered. Okay, you actually get a different plane of the view. Ultrasound use ultrasonic waves. Okay, so it can still pick up something different. You can still have, I'm not sure if the 3D is equal to a 2D plus an ultrasound, because it's kind of two different things being used.
The reason why I'm asking is because if you have a 3D, they don't recommend you getting an ultrasound.
Well, you pick up more on a 3D. You can pick up things earlier.
Okay.
But if you have, for someone, and you said 40 and above, but if you have someone 35, they're probably not going to offer them the 3D mammogram. They're going to do the ultrasound to determine what is this lump first. Okay. So routine screening, I would say a 3D is fine. You don't need to do ultrasound.
But diagnostic.
But diagnostic, they may end up offering an ultrasound just to make sure they capture anything else that you can see differently. Okay. 3D definitely is a better way to go, but that's not offered most places. I mean, we bring out the 3D.
Exactly. That's why I don't understand. You hear me, San Diego? Our women, we are in the community, and we are offering the state-of-the-art 3D. And a lot of people don't offer that. A lot of places don't offer that. So, come on now.
All the big health care providers, Kaiser, Scripps, Sharp, they have 2D. That's the normal mammogram, but the 3D state of the art actually gives you more definition and can capture things earlier than they would on a 2D.
Well, I noticed that. Okay, and just for the audience, I actually got my mammogram on the mobile coach, and I tell you, no pain, no nothing. And even though if I did have a little pinch, I'd rather have a little pinch and be here live and well today. But on our mammogram coach, oh my goodness, and I got to see all these different, what was it, from the side view? I mean, it was different. It was different levels, and I was really like amazed. And how she went around it. So because I had that done, I normally have to get an ultrasound. I didn't have to get an ultrasound because they had so many different levels of views.
And it's still your routine screen.
Exactly.
Because they just want to make sure that your right breast is still healthy.
Well,
so the minute okay, that's right. So they do. So what happens is they will do that, and if they see anything else, then they can determine if they need to do what they call a cone down view or add an ultrasound to it, maybe even add an MRI to it. There's several different other entities that you can use once they diagnose or see anything that looks at all concerning.
Yeah.
So that's the first level that they offer. And like I said, most places don't offer that. So, I mean, we're bringing out the 3D to the community, and we have to beg people to come out.
And we have to beg. We have to beg them to come out. I mean, that's why I'm just like, I mean, we have to beg. I'm down on my knees, okay, begging you guys to come and get a mammogram.
Free mammogram.
A free mammogram on top of that.
Yeah. So let me touch on a couple other of the risk factors that people may not be aware of, and that is if a young woman starts their menstrual cycle at the age of 12 or before, if they start their first period.
And I remember 2015 when I first heard you say that. Now that was a new, that was something new to me, that if you start your cycle early, then you are at risk
Right.
for getting breast cancer.
And so let me explain that to you, because if you start your cycles, your menstrual cycles early, and if you go through menopause later, because they also say that if you start menopause at 55, that means you have all those extra years of hormones, estrogen, playing a part on your breast.
Right.
The average woman might start their menstrual cycles at 15-ish, that's just average. And they might stop at about 50. Okay, so you've got, say, that's 40 years? Okay, but if you start your cycle at 10, which is what I did, and if you go, I have some women in my practice that end up having menstrual cycles till 56, you're talking about another 10 or more years of estrogen affecting your breast.
That's right.
So that puts you at much higher risk of getting breast cancer too. It's the estrogen that tends to be more of the risk that they find.
So it's more the estrogen.
Yeah.
Okay.
And then also another risk factor is if you have not had any kids, because obviously if you have children, you have no period for about 9 months, and if you breastfeed and you don't have periods, you can go a year or a year and a half without a cycle. That means the estrogen has also been diminished, and that gives you a window of opportunity where you're not having that estrogen playing a part on your breast. So multiple.
No interruptions in your cycle.
Yeah.
And see, I thought that was very informative. Women that never had children, I mean, they're actually at risk.
Exactly, they're at higher risk.
They're at higher risk. Yeah.
So you just figure out that piece. Obviously, if they've inherited this BRCA gene, the breast cancer gene, BRCA1, BRCA2, that tells you you're susceptible to breast cancer.
Yes.
I recommend that they get genetic testing if there's any family history of it.
But a lot of that's not offered.
I know it's not offered
in the African American community.
I know.
A lot of them don't even know what a BRCA gene test is. When I ask them, have you had? I've actually, when I a new diagnosed breast cancer person come to me. And as I'm walking them through, I'm like, had you had your BRCA test? Well, what is that? So that's another thing that I try to help spread and within them having that BRCA gene, because it's very important for them to know for their other family members.
Right. I think, and especially, if they're not going to do it for someone who is just a patient which has average risk. Which means if you have breast, you're at risk for breast cancer. And that's men and women.
Right.
But if you have a family history of a mother and an aunt or a grandmother or, a sister or something like that, you certainly are at higher risk. And I do recommend that they ask for, because not all providers will remember or will offer it, but to ask and say, I'd like to be tested for this mutation. This is a mutated gene that can travel through the family, and if they can test for it, then they can see if you're at higher risk. When my sister died from ovarian cancer at 53, that's also kind of related.
Yes.
So I went and got the genetic testing to make sure I wasn't at risk for breast cancer or ovarian cancer, because that's close family history, and so I don't have that mutated gene for breast cancer.
I don't either.
Right. That doesn't mean you're eliminated, but it means that if you have a family history of it, you need to check on that. So that's why we have to encourage our women that when they have a family history, that they should consider getting genetic testing to see if there is a higher risk for them.
Well, a few of them that I do know that I recommended, and they tested positive either for the 1 or for the 2.
Okay.
And so the one that tested, I think that they end up having their ovaries removed. Yeah.
And that is to remove the estrogen.
Yeah.
Because the estrogen is what feeds into this, and can put you at higher risk.
So I think that's them knowing about this particular blood test that they need to have. A lot of them just don't know.
Right.
So,
and I think the other thing, as you say, we spoke about weight being an issue when we talked about general health. Obesity, actually, believe it or not, they don't realize that, but obesity, the adipose tissue produces more estrogen. So that causes a higher risk. That's why obese women have an increased risk too.
Yeah, they do.
So it's important that they consider all the factors involved in what puts you at higher risk. And even if you have all of that, you don't have to get breast cancer, but that certainly is a factor that they should consider.
Yeah.
in that regard. And then taking birth control pills for 5 years or more, because of course
Yes.
that is estrogen and progesterone in a pill
Mhm.
that you're taking, and usually it's a higher dose than what you normally produce in your own ovaries.
Right.
So that puts them at higher risk too.
Right. And is there anything else that we can think of that put them at a higher risk?
I think basically it's mostly all related to the hormones. So even for our postmenopausal women, say you start having premenopausal symptoms, you start having hot flashes and mood swings and all kinds of other issues that we won't name on there, dryness and body aches and everything, insomnia, you name it. But if they start having some really horrible perimenopausal symptoms and quality of life is not good, the physicians may recommend hormonal therapy so that they can get their estrogen back in balance to help control their menopausal symptoms. But hormonal therapy does put them at some risk.
Okay, well, to our audience, what do you suggest do you recommend them going on the hormones?
It depends on the patient. If they have any kind of a family history of breast cancer, or if they've had some kind of an abnormal biopsy on their breast, I do not recommend hormonal therapy. We have to figure out another way to give them quality of life with their menopausal symptoms. And there are a few other things. You can't even, and you should stay away from soy because that tends to produce, some issues too.
See, I did not know. Let me just tell you. Back probably in 2013, I would go to Starbucks every single day to get my frappuccino with soy. Every single day. Until I found out soy was bad for me.
Yeah.
And I was just like, wow, I did this every day.
Right.
So it's so much.
There's so many things out there. I mean, we don't expect everyone to know. All of the things, we just expect people to at least go and get screened.
Right.
And I think it's important that they also know their own breast tissue so that they know if they have lumpy, bumpy breasts and they check it every month, maybe, a week or so after their menstrual cycle, that then the breast tissue is probably a little bit more in the normal stage. Okay. Around the around the menstrual cycle, it tends to be more lumpy, bumpy, and tender. So that's not the best time to do your own self-breast exams, but maybe a week or so after. Know your own breast tissue so that if something changes in there, you can bring it to your physician or provider's attention.
Right.
And then getting your clinical breast exams every year. Go to your provider, make sure that they check your breast tissue to make sure they don't feel anything that feels suspicious on exam. So those are some of the things that will be helpful. Did you want to try to go over some of the myths and things? So we can talk about a little bit of what breast changes they should be looking for.
Well, I think that we should
do that part.
Yeah, we should go over what I'll actually start off with some of the myths, because these myths that's in our community will actually have them
not get their exams.
But also it can ultimately lead to your death if you're going by a myth.
Right.
And myths, they're just not good.
Okay.
So
let's go over some of the myths, and then we can go over some of the changes that the breast can can be noticed on the breast exam.
So one of the my favorite, I just love to go to this. Wait a minute. What is the one? It's probably on the last page. Okay, I'm going to say hair straighteners cause breast cancer in African American women, which hair straighteners are what we call perms. So I'm going to say...
But I have no idea why they would even think that. I mean, obviously someone told them that, but I don't know who told them that, and I'm not sure. I would think, I mean, if we can that's why I want to go back to as natural. If you can stay as natural as you can, then you're avoiding any chemicals, because chemicals are not good for you. But I don't believe that hair straighteners have anything to do with breast cancer. Now, if you ingest a chemical, then who knows? Right. And I'm sure they're doing research on that, but the chemicals on your hair, at this point, no, that is a true myth.
Okay. Okay, if we go, overweight women have the same breast cancer risk as other women.
And we know, as I just mentioned now, it is not the truth. Overweight women tend to have a slightly higher risk for breast cancer because of the weight and obesity. The weight of that causes an increase in the estrogen production. and that can also stimulate the breast. So
Right.
yes, they are at higher risk, not the same risk.
Okay, and this is a good one because, and I think that I was like one of those ones that probably kind of believe this too. Small breast women have less chance of getting breast cancer.
So what I just said a minute ago, I told you that if you have breasts, you're at risk for breast cancer. So some men have breasts,
Right.
and they might have small breasts, but they're still at risk
But
for breast
because
cancer.
they still have breast
That's
tissue.
right. The breast, even as when young women, when they're first starting to develop breasts, they have
Right.
breast buds.
Buds,
They're
yeah.
like a little
Little-
bitty,
little-
look
little
like a mosquito bite.
Yeah.
Well, that's breast tissue. That's breast tissue, and you can still have breast cancer from it. So no, you small women with small breasted women are still at risk. It has
Right.
nothing to do with the size of your breast. It just has to do with the fact that you have breast tissue.
And you men out there, you hear men get breast cancer as well.
That's right. That's right. What other myths do you have over there that the women might be thinking of? I know one thing they talk about, if you, some of them say that if they get a biopsy, that it'll spread.
Right.
And that's not true.
Or if I go get a mammogram, that mammogram is going to give me cancer.
Yeah, that's not true
what they
either.
said, to give me breast cancer.
That's not true either.
Yeah, and I'm just like, wow, where do you guys hear this stuff at?
And unfortunately, they believe that before they believe the medical science.
Yes, they will.
Yeah.
And after you have breast cancer and you have a mastectomy, they believe that
You're not at risk for getting breast cancer anymore.
Right.
But that's not true either. Because number one, I mean, obviously if you have a mastectomy on one side, you still
Right.
have a breast on the other side.
Right.
And there still is some residual breast tissue, but yeah, you're at risk for the breast cancer on the side that was not affected initially.
Right.
Plus, if there's 1 or 2 cells that are left on the side that had the mastectomy removed, unless you had radiation or things like that, there's still a small risk
Right.
for the breast that was already affected.
Right.
So, if you get both breasts removed and your ovaries removed and don't take any estrogen, you probably have a chance of not getting breast cancer
Right.
again. But there is a chance of always having recurrence.
And
if
I
there's breast
tell them that, like I had the nipple sparing, so therefore I still,
You
even
still
though
have
I
breast
had
tissue.
even though I had a mastectomy, I still at risk on the breast that I had the mastectomy on. Still at risk for
Mhm.
getting breast cancer recurrent in that same breast.
Because you spared some of the
So
breast tissue.
so that's still there. It's
Right.
still attached. Yeah.
Right,
So,
exactly.
We said that we were going to get into the family, the mother and the father's history. So it says your father's family history of breast cancer doesn't affect your risk as much as your mother's, and they tend to believe that as long as it's not on their mother's side, father's side don't have nothing to do with it.
Yeah. Well, if they think back, I mean, if they took biology in high school, I mean, you have equal amount of genetic component from your father and your mother.
Right.
Okay. So the father donates an X or Y to make you a boy or a
Exactly.
girl, and the mother donates an X.
Right.
So you have equal amount of genetic component from both sides. And so yes, there's an equal share in the responsibility
Really?
on both sides of the family if you're at risk for it. So it's important to know your family history on both sides, but obviously for the people that don't know their family history and they feel like they're at risk, then they could certainly, if they're adopted and things like that, they could consider getting genetics if there's something else going on.
Okay, and one more. Exposing a tumor to air during surgery causes breast cancer to spread.
That's not true.
I know. I heard that in the community.
I know.
I mean, well, you ain't supposed to be getting no surgery, girl, because once you get surgery and that air get into your body, it's gonna spread.
Let me run, since we only have a few minutes, let me run through a few of the breast changes that can occur. So if women notice these, they can bring it to their provider's attention. And that is obviously if they feel a lump or a hard knot or some kind of a thickened area on their breast tissue or under their armpit, that's certainly a concern. If they notice a swelling or an area of warmth or an area of redness or darkening on their breast, that's also something. If they all of a sudden, most women might have a little bit of asymmetry. If they notice that one breast is starting to get much larger than the other one, there may be something growing in there.
Mm-hmm.
If there's dimpling or retraction, if the nipple's starting to pull in, if you have an outie and now you have an innie on your nipple, then that's certainly at risk. It means that something's pulling that nipple in.
Mm-hmm.
The other thing is if your nipple starts having a rash or is itchy or scaly or something on it, get that checked. I'm trying to think of what else. If you have discharge, obviously. If you
Oh,
have
yeah.
some kind of a discharge, even if it's milky, you should still get it checked. But most of the time, we're looking for dark discharge, bloody, black, green, anything like that.
Yeah, right.
So check that. And then obviously, if there's a new pain in an area in your breast tissue that does not seem to go away, it's not a muscle that you pulled or anything like that, get that checked too.
Okay.
So since we're running out of time, we should probably go to our announcements now.
Yes.
And
You do your first one?
yeah, let's just speak briefly about our community outreach event, Good Health Equals Long Life. It's every third Wednesday of the month. We had one yesterday here at Big Lots parking lot on 1655 Euclid Avenue. We're there from 10 to 6. We do blood pressure screening, diabetes screening, free mammograms, state-of-the-art 3D mammograms. We have hepatitis C testing, HIV testing. We had some hepatitis A vaccines. We're trying to bring flu vaccines out there and various other things. So come out once a month, third Wednesday of the month.
Okay, and join Komen San Diego, Circle of Promise, A Healthier Me, and Black Girls Rock San Diego, Black Women of Excellence Gala, October 28th at the 4 Point Sheraton, 8110 Arrow Drive, San Diego, California, 92123. We're providing 3D mammograms from 10 to 2 p.m. Dr. Afalo and I have a breast health and wellness seminar from 11 to 2. And we have a award ceremony, a fashion show featuring breast cancer survivors, and a all-female jazz from 5 to 9. So, hey, come on out and support the community and Dr. Afalo and I. And Dr. Afalo and I do have tickets, so hit us up on Facebook or contact us however, wherever you can. And also, the Race for the Cure is November the 5th, and it's at 8 o'clock, Balboa Park. I have a team. It's called Women of Strength. And if you guys want to be on my team, contact me on Facebook or email me at wendy@sdcoleman.org. Again, that's wendy@sdcoleman.org.
Okay, so you've been listening to the Many Shades of Pink and Black Health Radio program on kblkradio.com, sponsored by Many Shades of Pink.
I'm your host, Wendy Shurelds, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Afalo. And we thank you for listening. Make sure you stay tuned. Tune in every Sunday at 2 p.m. And go to the Komen San Diego Circle of Promise website. Go ahead.
At www.colemansandiego.org for more information on breast cancer.
And we're going to leave it at that so that we can capture the last commercial.
All right. So you guys have a great weekend.
I'm tired of seeing Black and brown women dying. They tend to have breast cancer that's more aggressive. They are at a 41% higher risk of mortality because we're identifying breast cancer at a later stage. Komen is here for women of color.
We are providing free mammograms.
It's important that the women of color get their mammograms, get treated, and save their lives. We are more than pink.